Good evening and welcome to our show tonight. My name is Jim McGuire, your host. And tonight we have a very important show tonight about breaking the silence of drug addiction. It's so important to break that silence and for people to talk about any problem they might have when it comes to drug use and alcohol use. Tonight the show basically is going to be about prevention, treatment, and hope. You know, our hope is so important for young people today. That's the trouble. That's our future generations. That's what the program is really about tonight. I just want to say a few things before we start. You know, for the last 10 years I've been watching television, you know, all these reports about people dying early and things like that, and epidemic of drugs. And when I think about it, I realize so many of these wonderful people, they get their life cut short. They get employment cut short, you know. They have no social life. They don't meet the right friends because of drugs. They're with the worst type of people. They don't continue their education and get a good education because of drugs. It stops them. And then the worst thing is the shortcut to prison. If you get into trouble and you do the wrong thing with the cops or with other people, you'll go to jail. And it's a no-win game, you know. So tonight I just want to mention that. And I want to mention who's on our panel tonight. We have with us tonight Steve Salomone. Steve's here, and he's going to talk a bit about drugs and its prevention. Also, his wife, Susan Salomone, is here. They're both from Drug Crisis in Our Backyard, by the way, and they'll be talking about this drug problem, especially in Westchester tonight. And from St. Vincent's Hospital, we have Lillian Nueman. She's the project coordinator.
Yes,
she's going to talk about the hospital and some kind of forum that's coming up, I think, but you'll tell the group about that. Steve, would you tell us a little bit about your life and about what you've been doing?
Sure, Jim. My name is Steve Salomone, and I am a Putnam County resident. I was born and raised in Westchester County. My wife and I started a group called the Drug Crisis in Our Backyard in 2012. We founded the group as a result of the death of our son Justin at 29 years old, a tragedy for us, as you can imagine. But at that point, we became aware of the stigma of addiction and how secretive it was, and we formed the group. One of our primary missions in the group is to break that pattern of hiding that people experience when they have a drug issue in their family. So that's why we formulated the group, and we've had a number of forums, and we've been very involved in the community. And Susan can speak to some of the things that we're doing on a state level now with Governor Cuomo. But we for the last 2.5 years, we've been very involved with trying to be an advocate to help addicts and to promote prevention of drug addiction.
Thank you, Steve. How about you, Susan? You want to say a few words?
Thanks for having us on, Jim. I really appreciate the time and the opportunity to talk about this problem. You had mentioned over the last 10 years that you heard a lot about drug addiction. We were dealing with drug addiction with my son Justin for about 10 years, and he passed away 2 years ago. And actually, we didn't hear anything about it. And we felt very, very much alone, and that we were the only ones dealing with this problem of heroin, which was a big drug in the 60s and 70s, but never expected our son to be addicted to heroin. And that was another reason why we came forward after he passed away, because it was such a long battle for him. He tried so many times to get clean, that we connected with Carol and Lou Christensen, who also lost their son just about the same time. We lost Justin May 29th, and Eric died on June 9th. And we connected with them and decided to start Drug Crisis in Our Backyard, because we felt that people needed some way to come out and talk about what was happening in their family and with their loved ones. So this has been our mission for 2 years now, and we've really gotten a lot of press, and there's a lot more information about heroin addiction in the public eye right now.
Thank you, Susan. How about you, Lillian? You want to say something about your early thoughts?
I've been doing this for over 20 years, working with people from the disease of addiction. And I grew up in the Bronx, 60s, and there's a lot of drugs. And as Susan said, there was a lot of heroin. I come up to here in Westchester, and I'm working at St. Vincent's, and the last 2-3 years, this heroin has resurged. And at St. Vincent's, we've got, programs for mental health and addiction, substance abuse, inpatient and outpatient. But a lot of people don't come into treatment. There's the shame, there's the silence, there's the embarrassment, and people just stay at home, and they hide. So I've heard about drug crisis in our backyard last year or so, and I've been going to the events, and I met Susan and Steve, and I said, we have to do something. We have to partner with you guys and St. Vincent, and we came up with Breaking the Silence and Stigma of Addiction to get the word out there for parents and families that this isn't shame-based. I mean, addiction is a brain disease, and we'll talk about that. But there isn't shame here, and there is help out there. And just come to the forum, call, ask questions. And that's how we got connected.
Could you tell us about what's coming up at St. Elizabeth's Hospital?
St. Vincent's Hospital.
St. Vincent's Hospital. Can you tell us about that?
Yes, the forum is Breaking the Silence of Stigma and Addiction. Carol and Steve and Sue and Steve and her family were going to speak about how it affected them, it impacted them. We're going to have a Dr. Arnstein from Montefiore Hospital speak on the brain and how the brain changes the structure of the brain, drugs, and it continues a person using. People think it might be like a moral or background or family, but it's not. This relapse, it's a brain issue, and she's going to speak about that, and there is hope. There is hope. We're going to have a family speak about recovery, a father and daughter speak about what they went through with this disease. So.
I'd just like to add a little bit to that, because it's really exciting to have a doctor on the panel, because this doctor is an addiction specialist, and she will talk about how this is a brain disease and how it affects the part of the brain that makes decisions. So people think, like we even thought, like, why doesn't he just stop? He's ruining his life. Like he's losing his jobs. He can't graduate college. Like all the things you said in the beginning. Why can't he just stop? And part of that is the fact that their brain is, the part of the brain that makes decisions is affected by the drugs they're taking. So I'm happy to have a doctor there to talk about that. I think it's really important.
Right.
It's important, Jim, because when you talk about trying to be a family member that's dealing with addiction, you have to understand that you can't, logic doesn't apply. I mean, you really have to get a new a set of tools to work with a professional, with counseling, because you can't logically sit down with someone and hope to rationalize this away. It doesn't work that way. You have to really address it at a different level. Justin, we sat down many times and had, I think, a sincere desire to quit. It's cognitively, he wanted to change his life, but because of the way that the drugs had affected him and the physical addiction as well, it just wasn't possible. So I think the education for people to know what tools are available, how to deal with it, how to talk to an addict, and how to deal with an addict, I think are important, and that's part of what the forum is going to be about. And I think it's important for people to understand that you have to learn this new set of skills in order to deal with the problem. Is
that a picture you have there?
Yes.
You want to hold it up?
This is our son, Justin. We bring him everywhere we go. He puts the words in my mouth. Sometimes I wonder where the words come from, actually. And I really believe that he puts them there.
Very nice. Nice picture. Very nice.
And if I may, there are just so many families out there. As you said, their kids, the young adults, they want to stop using, and they've gone treatment after treatment after treatment. And families feel like they failed, and the people using feel like they failed. And coming together and saying, look, we have to look at this in a different way. If I can, there's something called the 5-15 rule, that when an adult starts using, 25 and over, it takes them between 5 and 15 years before they'll get addicted to the drug. If a young adult uses 14 and up, it takes them between 5 and 15 months to become addicted. But when a young kid between the ages of 9 and 13 start using, they become addicted within 5 and 15 weeks.
Wow, what amazing.
Wow,
and we've seen studies, Jim, locally. I know that Putnam County did a study. Age of first use of drugs and alcohol is about 13 years old, and those are from surveys at the school, surveys with the children. So I mean, they're admitting it themselves.
Absolutely.
So that's why we really need to get ahead of it. You make a good point, Lillian, because the battle is so much more difficult
That's right.
when you're dealing with somebody that started that young.
That's right.
And it's a difficult pattern to break.
Because the earlier they start, the harder it is, the more treatment, and the longer they are going to be out there using. So that's why prevention and coming out is so important for the middle school and the high school kids. You know, just prevention, prevention, prevention.
More education.
And education, that's right.
yeah,
Education on this,
Right.
on everything
And
about
that
this
goes
disease.
back, that really goes back to bringing it out into the public eye so that people are not afraid of it. Because I think that what the reality of this is that people are afraid of this, so they don't want to look at it. They are afraid of addiction, they're afraid of drugs, so they don't want to look at it. And actually, Governor Cuomo just launched a campaign called combatheroin.gov. It's combatheroin.newyork.gov. That's the website. But it's a public service announcements about heroin addiction. That's how bad it is. New York is one of the worst states in the country.
Wow.
We moved up pretty quick
Yeah.
to be the worst.
Yeah.
And it's coming from people using the prescription pills, because people do not see the harm in prescription pills. They come from a doctor, but you might not have been prescribed them. And doctors are getting more educated now, but they're giving out these large number of pills in one time, and people get addicted to them. And then when they get too expensive, the next thing is heroin, because these oxycodones, Vicodins, they're opiates, and people don't realize when they're taking them, they're going to get addicted. It's an opiate, so that's why the transition to heroin is the only logical step.
And the prescription pills are starting to become more difficult to get because
Right.
the doctors are under more
Yeah, the
scrutiny.
crackdown,
Right,
right?
the
And we
eye
have the
stop.
I-Stop
That's
law
right.
now, which is all good stuff, but the unintended negative
That's
effect
right.
of that is that people are turning to the street to get
right.
their drugs now. So.
And it's so much cheaper.
What a different world it was in the 50s and 60s when people would have a glass of beer. You know, really, when you think about it. Different types of brands of beer. But now, look at the complexity of what's available to people today. That's the tragedy of it.
The stakes are very high.
Boy, oh boy,
And I
so-
think it's interesting that you mentioned that because, you know, as a child, experimentation's part of, you know, what you expect. But when you're experimenting with an opiate, the stakes are so high because the addiction and the changes to the brain happen so quickly that all of a sudden it's a game changer. Now it's not just, oh, I've decided I don't want to do this anymore. That decision is now taken out of your
right.
control.
Right. Just for the people who don't know, what is the forum again? What really is
What
the
is the
forum?
event?
What is the forum? What does the forum mean, the forum? This is the
forum-
8th forum?
This is our 8th event. We call them forums
Yeah.
because they are, you know, they're events where we educate people, and we had just given them the name forums, but they're like conferences. So we have multiple speakers, and at the end of it, we'll have a panel where the audience can ask questions of this educated panel. And it really is just to continue our mission of bringing awareness of the rampant use of opiates and heroin in our community. And this time we're doing it in Westchester. This is our first one in Lower Westchester. We have done it a couple before with Phoenix House. So we invite the audience to attend.
Right, very good.
We've had a good response, Jim, I think, because the forums are informative. We have speakers, but they're also interactive. We get a lot of people coming forward. As we said earlier, Susan mentioned, you know, people have this fear of coming out. So I think the forums give them, we call them forums because they're kind of a forum for if you're having a problem, or you don't have to be embarrassed. You can come and talk to people that are experiencing the same thing.
Right.
But there's professionals there as well that might be able to help you. So we're all kind of speaking the same language and talking about a problem from a personal level, in a sense. So that's they've been very well received.
And down in Westchester,
Yeah.
heroin's down there. Kids and people are using the prescription pills, but it's kept so quiet that when, and listen, I'm not judging or pointing fingers, but when a family member dies, a young adult, they're calling it an illness instead of saying an overdose because of the shame and the stigma about it,
Yeah,
about
sure.
having a family member who was using heroin.
Sure.
Because there's a hierarchy of drugs, you know. You can, alcohol, marijuana, maybe a little cocaine, but the heroin and then the crack, it's like no one wants to talk about that. It's like a hierarchy, you know. People will say I smoke pot or I drink, but not heroin, you know, not
Sure,
crack,
sure.
you know. So
Is
that's the shame.
marijuana still the gateway drug? would
It
you
is.
say?
Research shows 25 million people between the ages of 12 and up have smoked marijuana and are smoking marijuana. And they're also showing research that if you smoke marijuana, not that you will absolutely go to other drugs, but your brain is susceptible and vulnerable to opiate addiction, cocaine addiction, and alcohol. Those are the 3 drugs. So our young adults that start smoking pot think it's no big deal, I'm just smoking pot. Once they try something else, opiate, cocaine, or alcohol, let's stick with the opiates, their brain is already vulnerable for them to become addicted.
So Colorado's not doing the right thing in a way when you think of what they're doing out there. Unless it's for medicine purposes, you know, people are very sick. You know?
Right. I'm like,
know.
I'm against legalization of marijuana.
That's wicked, yeah.
Everyone I've spoken to that has lost their child, they've started with alcohol and marijuana.
Right.
Yeah.
And
Those are 3
alcohol
drugs.
is legal already. And
right.
so why legalize another drug that not everyone's going to get addicted,
right.
Jim?
Yeah.
That's right.
But some percentage of these kids that are going to try legal marijuana are going to get addicted. And why put them at risk?
Well, the trouble is, if you go to a party and you think everybody's going to smoke marijuana, what about the people who are there using the other drugs? And they say to you, hey, why don't you try this? What are you, a chicken?
Right.
And then
right.
you say, oh, I better try this and look good in front of everybody. And then you're off to the other thing, you know?
Right.
That's right.
Once
Once you start with one bad decision, the other bad decisions follow very rapidly.
And
So
the peer group doesn't help you.
it doesn't help you, and I think it's bad, unfortunately, with this on a state-by-state level with this legalization of marijuana. It's really sending a really bad double message, a conflicting message. Here we have young people dying in increasing numbers. If you look at the graphs and you see the number of overdose since the mid-90s, it's unbelievable, and yet we're starting to legalize marijuana.
Right.
What's wrong with that picture?
right.
Terrible.
It doesn't make any sense.
It's a disgrace. It is.
Because, I'm sorry, it's almost
Sorry.
seeming like they're not taking into consideration that if the brain does change, and if smoking marijuana, which it does, makes you more susceptible for these other drugs, then they're actually telling you, smoke it, and you can just take your chance that you might become more susceptible to doing opiates and
It's
then
not-
dying.
exactly.
I mean,
You know,
it really is crazy.
It's not the drug itself that, like, say, marijuana leads to heroin. What it is, it's a decision-making process that happens in the brain. And so why are we allowing people to even make a decision that says, let me try something that's bad for me because I'm going to get high?
Right.
And that's really where the breakdown is. When you make a decision that it's more important for me to get high than I'm worried about my health or worried about danger, then you've made a bad decision,
Yeah.
and the other decisions follow.
Sure, sure.
thereafter.
It's like drinking and then driving the car.
Right,
Right.
You should really
Exactly.
call a cab.
right.
Right.
I think I'll drive my car, you know?
And what they're finding out, in Colorado is people are having accidents driving under the influence of marijuana, but there's no tests. You can't blow into a breathalyzer. You can't do the standard tests. So they're having a lot of problems out there, and they didn't think about this beforehand.
Terrible. What goes on at your hospital? Is there treatment there?
There's
Could
treatment.
you tell us a little bit
There's
about
treatment for substance abuse, mental illness. We have inpatient, outpatient. We treat adults and we treat adolescents, teenagers, and we also, in our outpatient program, we have kids that are coming in as early as 5 years old with, depression, anxiety, mental illness. We also have partial hospital, which is a program for adolescents separate from adults if they're coming out of a hospital, like Four Winds, and they need to be stabilized. We have now a program in Port Chester, and we have a program in Tuckahoe called Maxwell. So St. Vincent's has a lot of different programs, and the best thing is call. You can get information on all the programs. So just call our main number.
Very nice.
And this event.
Oh, I'm sorry. What's your number?
Oh, my number is
Sorry.
914-925-5320. That's evaluation and referral, and you can call them, make an appointment, or just walk in.
There's the number up
Walk
there,
in,
good.
and there's the number. Thank you.
Yes.
The event is October 22nd at St. Vincent's Hospital in Harrison. And it is important that if someone wants to come, Jim, that they should call Terry Ezekiel and register, because we have limited space in this facility where we're having it, in the
Is there a
conference
phone number
room.
for that person?
That would be the same number. She
Oh, the
can
same number,
call
okay.
914-925-5320, and ask for Terry Ezekiel, and they'll put her through, put
Okay.
them through.
Very good, very good. I just want to ask, Susan and Steve, what really fuels the use of drugs? Is it peer pressure? What do you think it really is that fuels people to use the drugs?
That's a complicated question. I'm sure you recognize that, but I think one of the things, Lillian, I like what you said, because there are signs that someone has a propensity to use drugs at a very early age, and so I think also parents being aware of potential underlying mental issues at a young age is important. Certainly, I mean, that's one of the things that you want to be aware of: anxiety, depression, just things that happen that may normally happen, but some people have trouble adapting, and they tend to turn to drugs to try to mask those feelings. Mm-hmm. So I think as a parent, you want to be aware of that, and not that you want to be alarmist, but that you observe your child, and don't be afraid to seek professional help if you feel like you want to talk to a counselor about something that might be going on.
You know what else? Mm-hmm. It's kids experiment. There's 4 phases. There's the experiment, they see what it does, say they smoke pot or they drink, and they like how it feels, mm-hmm. but they have some minor consequences. Maybe they start missing school, they get into some arguments with their family. So some kids stop. Then there are kids that say, okay, those are small consequences, not a big problem. Let me just continue using. And then what happens, they continue using, they like how it feels, they get into trouble, the consequences get a little more, but then they don't equate it to their using. So that's how the denial fits comes in.
Yeah.
And then it just progresses from there.
Right. Let me ask you, what is tough love? Can you give me a little example what that is, tough love?
We've talked about this in the past, Jim. Tough love, people may have different definitions of it, but I see it as really like kicking someone out of the house. If they're home, they're struggling, they can't get it, they can't stop, and you finally give up. They're stealing from you. You kick them out, and you tell them you can't come back. Or you might give them an alternative. You could say, you can't live here if you're using drugs, so you have to leave. So that's the way you get them out of the house.
Right.
And it is a very difficult decision to do. It's very, very difficult.
It's a fine line. Tough love is to stop enabling is really what it comes down to. But it's very easy to enable because you're always protective of your child, mm-hmm. and you want to try to help them get better. And I think it's a tough problem for a parent to face, because you don't want to help them, right. But by the same token, you don't want to see them die, because they say an addict will get better when they reach bottom. Well, my son had a brain injury from a drug addiction, and that wasn't his bottom, even though you would think that it would be. And his bottom for him was death.
And I think also what we have to also remember, did I just forget what there I go, I had a brain freeze for a moment, is that when we talk about tough love and making these ultimatums, our family members, due to this addiction, they know how to manipulate. I mean, and they know how to tell you what you want to hear. And here's your pumpkin, your child, telling you these things, and you hold on to them. And that's what tears at families also, because that tough love step, that's a biggie. And then you have kids making promises that they really do mean at the moment.
That's exactly.
They do. They mean that.
They mean it.
They mean
they do.
it.
And they want it too. They want it for themselves.
Do.
But then the drug gets control of their brain again, and they say one more time. And one more time could either be death, or it could lead to many more times out there, being out there again for another 2 years.
Mm-hmm. It's a bad cycle too, because the failure, when they really try to make those promises and get better, and they do, but then they fail because the drug pulls them back. It's almost worse at that point, because they feel terrible about themselves.
It's guilt and shame that kicks in.
Exactly right, and they don't feel good about what they're doing to the family. They don't feel good.
There's no person out there who's using feels good. They don't, they don't feel proud of themselves and what they've had to do to get the drugs.
Right, exactly right.
It's just a horrible, horrible situation. Sorry.
Do you think there should be greater education in the middle school and high school,
Well,
and even elementary school about what drugs are doing to people? Shouldn't there be more education involved?
I think that first, on an elementary school level, children need to learn how to cope. They need to learn problem solving. They need to learn teamwork. I think more character building needs to be done at an elementary school level so that kids know who to turn to and they know how to solve problems instead of thinking they have to solve problems on their own, or they know who to turn to solve problems. Because one of the issues is with drug addiction is feeling very isolated and feeling like you have to take on everything yourself. And kids that are anxious, they have a hard time with that. It makes them scared, and so they want to, take something to feel better.
Yeah.
And you know what, through my job at St. Vincent's, the community fund, I go out to the schools, in the elementary schools, and do presentations on problem solving and bullying, alcohol, tobacco, bullying, and just the problem solving steps for these kids that they can just start making decisions so that they're not so alone. And as they get older, of course, the problems get bigger. But if they're taught these steps early on, they can hold on to them and practice and use them.
Sure.
And
Build
go to
up a
different
self-image,
schools.
like
Self-image,
a good
self-esteem.
self-image, not a celebrity self-image like
Right,
you see, but
right.
a real one.
Absolutely.
So that's,
There is a lot more going on in the schools, Jim. There is films being shown by peers influencing peers, Chasing It. It's called Chasing It. And that's being shown in the Putnam schools right now. So there are efforts being made on every front to combat this epidemic.
Listen, we have to close.
Oh,
I'm sorry.
okay.
It flew by.
We can go on forever.
We can just sit here and talk some more.
Listen, thanks so much for coming, okay?
Thank you.
All right, thank you very much.
Jim.
We
We
really
appreciate it.
appreciate it.
Thanks a
do.
lot for
Thank
watching
you.
the show.
Thank
Okay.
you.
Bye now.
It was good.